Hello, my name is Sharon Talboys, and today I'm presenting Beyond Access, Investing in Women's Health and Wellbeing in Utah. This is findings from a qualitative needs assessment, which is a subset of a larger statewide mixed method study that included online questionnaires, surveys, so people could rank and the level of importance and the priorities they have for women's health, but also maternal and child health. And today I'll be focusing on the findings related to women that we gathered through interviews and focus group discussions, where we did key informant interviews with public health, healthcare, and social care providers around the state of Utah. We also did some of those in-person focus groups. We also met with community members, primarily women, to talk about their healthcare needs through live chats through Zoom, as well as Zoom focus groups. In total, we had 88 community members participate, 11 of whom spoke Spanish, 55 providers, most of those, 67% identified as public health professionals, and we also had a variety of other healthcare professionals. You can see some of the characteristics here. We had primarily women overall, and community members tended to be a little bit younger, and also more diverse with respect to race and ethnicity. And providers tended to be more female, a bit older, as we did recruit subject matter experts, which tended to be more senior level positions, and a bit less diverse in terms of race and ethnicity, and more highly educated. We had good representation statewide, including from rural. Our key findings really focused on our key findings revolved around four cross-cutting themes, really getting into basic needs, those social drivers of health, or those basic requirements we need to be able to thrive, and even begin to access the care we need and to navigate our healthcare system. Access to care issues, the services that are in high demand. What's the priority for women right now? Conversely, the health system issues, what issues came up that might hinder or help how we access care? Is it of good quality? And then lastly, health literacy needs. Women were really keen on learning more about how to navigate healthcare and insurance. They want information on nutrition, mental health, prevention, and other services, parenting and healthy relationships, and sexual and reproductive health, among other things. You can see that we gathered many stories, and I won't detail them all now, but just to underscore, for basic needs, we heard of families, multi-families renting a house where each family gets a bedroom, just to address housing, and this shows the reality of what it's like when we say unaffordable housing. The issue of inflation came up quite a bit, and also the issue of, for people who do rely on benefits that really are essential in terms of getting a leg up and moving into a more healthy and prosperous mode, is this catch-22 of, if you make too much money, then you lose all your benefits. But people don't want to not do anything. They want to be able to contribute and make some money without it being an all or nothing benefit situation. Again, navigating healthcare, the cost, and also huge, a lot of stories around just difficult in accessing specialty care, that there's not enough of them, especially in rural areas. Finding an OBGYN, pediatrician, women's healthcare expert is difficult, and finding mental health care is also a challenge. So overall, our key finding is a recommendation that we invest into health literacy for women, in thinking of new and innovative ways, such as getting into women's chat groups, social media groups, parenting groups through social media, and also working together with policymakers and programs like Medicaid and others, and WIC, on streamlining some of these eligibility and administrative steps to be able to access these really important services that are really valued and mean a lot for the health of women in Utah. For more information, scan our QR code There's more there, and future publications will also be posted there. So stay tuned. It was nice talking with you today. Thank you.